is a serious medical complication that affects millions of mothers and babies each year. It's defined as labor that occurs before the 37th week of pregnancy, which can lead to a range of health problems for both mother and child. Despite advances in medical technology, preterm birth rates remain stubbornly high. However, there are steps that mothers can take to reduce their risk of preterm labor and ensure that their babies are born healthy and happy. In this video, we'll explore the causes of preterm labor, the risks it poses to mothers and babies, and the most effective strategies for preventing it. Segment 1. Causes of preterm labor. Preterm labor can be caused by a variety of factors, some of which are still not fully understood. Some of the most common causes include infections, hormonal imbalances, and physical stress on the mother's body. Other risk factors include smoking, drug use, and a history of preterm labor in previous pregnancies. In some cases, preterm labor can also be caused by genetic factors or problems with the mother's cervix. Segment 2. Risks of preterm labor. Preterm labor can pose serious risks to both mothers and babies. Babies born prematurely are at risk of a range of health problems, including developmental delays, breathing difficulties, and infections. In some cases, premature babies may require extended stays in the neonatal intensive care unit, NICU, which can be emotionally and financially draining for parents. Mothers who experience preterm labor are also at risk of complications, including bleeding, infection, and damage to the reproductive system. Segment 3. Prevention strategies. There are a number of steps that mothers can take to reduce their risk of preterm labor. One of the most important is to receive early and regular prenatal care, which can help identify potential risk factors and allow doctors to take appropriate action. Mothers should also avoid smoking, drug use, and excessive alcohol consumption, all of which can increase the risk of preterm labor. Eating a healthy diet, getting regular exercise, and managing stress can also help reduce the risk of preterm labor. In addition to these lifestyle changes, there are a range of medical interventions that can help prevent preterm labor. These include medications that can help control blood pressure, hormone levels, and infections. In some cases, doctors may recommend bed rest or hospitalization to help manage preterm labor. Mothers who are at particularly high risk of preterm labor may also be given cervical circlage, a surgical procedure that helps reinforce the cervix and prevent premature dilation. Segment 4. Real-life examples. Preterm labor is a serious medical complication that can have a profound impact on families. But with the right strategies and interventions, it is often possible to reduce the risk of preterm birth and ensure that babies are born healthy and strong. In this segment, we'll hear from real-life mothers who have experienced preterm labor and learn about the strategies they use to manage the condition and give birth to healthy babies. Preterm labor is a complex and multifaceted issue, but there are a range of strategies and interventions that mothers can use to reduce their risk of preterm birth.